joining our webinar today. This is Clare Anderson. I am a policy fellow at Chapin Hall at the University of Chicago, and I'm delighted to present in partnership with the TA Network for Children's Behavioral Health on child welfare and systems of care, opportunities for partnerships. I'm going to tell you a little bit about the purpose of the webinar and tie it to a new brief that is available online. The webinar and the brief are titled Child Welfare and Systems of Care, Opportunities for Partnership. And what I hope to do today during the webinar and in the brief is to describe new federal child welfare activities that may be of interest to those of you who are working in systems of care across the country, as well as in child welfare. I'd like to offer some suggestions for initiating or deepening partnerships across systems of care and child welfare. And most importantly, I think, as a takeaway from the brief and from the webinar today is this notion of using the tools that I'll describe today as well as the brief for advocacy and partnership development in your communities. You'll see at the bottom of the slide a link to the brief, and I encourage you to take a read and use it to think about partnerships across child welfare and system of care. I'll start with a little bit of background about child welfare and the context in which the brief is written and the current policy context for child welfare. So historically, child welfare has a policy mandate of safety, permanency, and well-being. This was clearly articulated in the Adoption and Safe Families Act of 1997 and has been articulated numerous times in numerous pieces of legislation, that these are the three pillars of the work of the public child welfare system. There have historically, though, been challenges in both defining and measuring well-being. There has been much more emphasis on defining and operationalizing safety for children where child maltreatment or child abuse and neglect are occurring. And it has been certainly within the last 15 or so years a very clear focus on permanency, finding homes quickly that are permanent for children, either returning them to their own home that has been, where safety issues have been addressed, or in finding kinship homes or adoption homes so that they can grow up in a family rather than in the custody of the government. And so safety and permanency have been, I think, well operationalized, but this well-being idea or construct has been more challenging for the child welfare system to articulate and act upon. And so there has been, in an effort to try and address well-being, a reliance on defining well-being success as whether or not a family was referred to and received a service, and often those services were relatively generic in nature, parenting classes, anger management classes, and were not targeted necessarily to improve a specific set of outcomes. And then there's also been a lack of standardized screening and assessment to understand how well a child is functioning, how well a family is doing, and there's been a lack of evidence-based interventions that could be deployed readily and easily to improve outcomes for kids and families, and progress monitoring to determine whether or not functioning is improving as a result of our interventions has been a challenge as well. But in the last 5 or so years, there has been increased attention on well-being. which opens, I think, new opportunities in communities to think strategically about our entire system of care and how do we collectively help children and families to do well. So at the federal level, within the U.S. Department of Health and Human Services and the Department of Justice, there's been an emphasis on well-being, really across all of the work in child welfare. There were guidance developed and disseminated, new funding announcements were created, federal budgets were organized to improve well-being, and certainly there have been policy levers pulled as well that articulate an approach that addresses trauma, early adversity, and the need to help children heal and recover from abuse and neglect. There was an understanding about well-being in the context of a healthy developmental trajectory for children, understanding whether or not a child was on track with developmental milestones given their age and family and personal characteristics, or if a child was off track developmentally because of the trauma and early adversity and toxic stress experienced in a household. And the federal government also worked to encourage and incentivize the use of screening, functional assessment, and evidence-based interventions to ameliorate or address the needs identified as a result of ongoing challenges that children and families are facing. So this is the new context in child welfare that allows for us to have this discussion today about how system of care and child welfare might partner to realize this new direction. So first, really trying to understand at the federal level what it means to make well-being measurable and actionable. And this visual, and you'll hear me talk about the components of this visual across the time that we're together here on the webinar. So I'll walk through it a little bit so that you can hold it in your head as you hear me talk about tools and opportunities that are organized around it. So this notion of screening and functional assessment, really as children and families are coming into the child welfare system to understand how well they are doing and where there are strengths, as well as where there are needs and challenges that could be addressed. For those children for whom screening and assessment indicate a more significant need, referrals for clinical assessment with a mental health professional are indicated. In either event, organizing case planning around the information identified in the screening and assessment. What needs to be addressed, and how might we address it in a way that allows us to get from here to a place where a child can be home safely. Using evidence-based interventions that are strategic and time-limited and involve not only the child but also the parents and the caregivers in the healing and recovery process allows us to get to a set of safety, permanency, and well-being outcomes so that you see this integration of safety, permanency, and well-being across all of this work. Certainly, the context is important here, and you'll see at the top of the slide that therapeutic, responsive, supportive, stable relationships and settings are core to children and families doing well. We know quite well now from the evidence and the literature and research that children's well-being depends quite heavily on the relationships that they have and the context in which they find themselves. Across the bottom of this visual, you'll see progress monitoring, social and emotional functioning, so that we are continuously checking back in using a pre and post functional assessment, for example, to determine if the interventions that we have put in place are having the desired effect, whether or not mid-course corrections are needed, and whether or not we are helping to return a child and their family to a healthy developmental trajectory. This work, we think, is quite aligned with system of care principles, and I'm going to highlight two that I think say the exact same thing that I've just been talking about, but in slightly different language. The first is ensuring that children and youth receive effective services, and what you'll see throughout the webinar today is an emphasis within child welfare at the federal level on implementing evidence-based interventions, those effective services that have some evidence of effectiveness in the research and literature is a hallmark of this work, and tracking and monitoring improvements to manage the achievement of goals. We just talked in the last slide about ongoing progress monitoring to make sure that we're on track. Understanding not only is a child getting better, but are we as a system getting better to ensure that children and families are able to meet their goals. So we're going to talk about a number of documents, guidance, tools that were developed over the last 3 to 5 years, really beginning in 2010 under the leadership of then Commissioner Brian Samuels at the Administration on Children, Youth, and Families. This document is really the foundational policy document that was disseminated to the field that established a rationale using both research and evidence and cost data and an understanding of needs of children and families to say that we needed to focus on well-being in a way that we really had not previously. And it defined a framework for understanding the domains of well-being: cognitive functioning, behavioral health and development, behavioral and emotional functioning, and social functioning. You'll see the link to this framework down at the bottom of the slide. I encourage you to take a look at it if you have not seen it yet. In addition to laying out a rationale and a policy approach, it also really defined well-being. So you'll see that while this is a somewhat busy slide and you don't need to read everything that's here because I'll walk you through it, you'll see the domains of well-being on the right side of the table: cognitive functioning, physical health and development, emotional behavioral functioning, and social functioning. And you'll see running down the left column are the age ranges of children that really sort of chunk out in developmental stages from infancy to early childhood, middle childhood, and adolescence. And we know and understand that there are milestones, developmental milestones, that need to be achieved as children grow into healthy adults, and that they are accumulative. It's important to meet milestones early so that you're well positioned to meet milestones later in childhood. We also recognize that in order to do that, as I said earlier, context matters. There are, as you'll see in the two columns on the left-hand side of this table, there are environmental supports that make this possible, and as well as family supports. And there are personal characteristics, or what we think of as temperament, that can influence the achievement of healthy development as well. We think, having looked at the literature and based much of this on work by Liu et al. And Anthony Biglin et al., that really helping child welfare and other human services fields understand that well-being is not a nebulous construct, but it's highly measurable, and we can understand where a child is on a developmental trajectory and how to bring them back on track. We also recognize that one guidance document may not be the best or the only way to help people understand why promoting social and emotional well-being along with the other areas of well-being are important. And so we commissioned a set of papers that articulated the need to integrate safety, permanency, and well-being, and provide examples of what that could look like. The first document in the series is an overview that really talks about the history of child welfare from the 1970s onward and tracks how we got to a place where we were able to now our own selves developmentally focus on well-being, given all the work that has been done thus far on safety and permanency. The first paper is a re-articulation of the well-being framework, the chart I just showed you previously, but also helps the reader to understand what is going on at each developmental stage, infancy through adolescence, and identifies a number of evidence-based interventions that could be deployed at each of those developmental stages to help children and families when things are not going well, or to help strengthen and support healthy development in times of stress and challenges in families. The second paper, Screening, Assessing, Monitoring Outcomes, and Using Evidence-Based Practices to Improve the Well-Being of Children in Foster Care, shows how screening and assessment can be used to understand where a child is developmentally and how to use that information in an ongoing outcomes monitoring fashion or progress monitoring fashion so that we can help children get back on track developmentally. And the last paper, a case example of the Administration on Children, Youth, and Families Wellbeing Framework, the Kansas Innovation and Permanency Project, really talks about work that was designed as part of a grant program to address the needs of children who had been in foster care for longer periods of time, and trying to understand if there were ways that we could help children earlier, before they had been in foster care for extended periods, to get back on track developmentally, help their families create safe, supportive, stable, and nurturing relationships and environments so that children could go home more quickly. And so what we really tried to do with this last paper was to help the field see what the well-being framework looks in action. Part of the work that we did in HHS was to craft a set of partnerships that were relatively unprecedented to try and help the field understand the numerous resources that could be brought to bear to promote well-being of children known to child welfare or at risk of becoming known to the child welfare system. And I want to highlight two of them that I think can be quite useful in communities as they are organizing or reinvigorating their system of care. The first is what we refer to as the trauma letter, and like many of the other tools, it encourages the use of integrated trauma-focused screening, the use of functional assessment, and evidence-based practices in child-serving systems to improve well-being. It articulates the various resources at the federal level that are available in the child welfare arena, in the mental health arena, and in the Medicaid arena that could be deployed independently or jointly to try and help a community or a system to focus on trauma and to help children heal and recover. There's a strong acknowledgement within HHS that addressing the effects of trauma early can prevent long-term health and productivity challenges that are created when, can be created when children experience early adversity and trauma. The second letter focused on the over-reliance on psychotropic medication for the same population of children. So in some instances, certainly not all, children are not receiving evidence-based interventions and functional screening and assessment to really try and understand and ameliorate the behavioral and mental health consequences of trauma and adverse childhood experiences. So this letter really said two things. One is we want to encourage a psychosocial approach as a first-line treatment. When that approach is insufficient to help a child get on track developmentally, using psychosocial interventions concurrently with psychotropic medication is an important option. And then third, it really encouraged and laid out mechanisms by which oversight and monitoring of psychotropic medications could be enhanced, both at the federal level and in communities. So both of these, I think, serve as well-organized tools to use in your communities to understand and craft an approach to focusing on well-being. In addition to guidance, we also organized almost all of our discretionary funding to the extent possible around promoting well-being. And there are 3 discretionary funding grants that were provided over the course of several years at HHS that I want to highlight for us today. And I've included the awardees here so that as you're listening, if you see or hear about your community, you'll know that these are places that you can go to engage with like-minded colleagues who are also interested in promoting well-being. So the first is promoting well-being and adoption after trauma. It encouraged the use of screening, assessment, and evidence-based interventions for those children who have a goal of adoption for permanency in order to help them be on track to do well in an adoptive home and to remain in that home through adulthood, into adulthood. It also allowed for supporting families and children after the adoption so that in those instances where challenges arose, that interventions could be put into place. The regional partnership grants to increase the well-being of and improve the permanency outcomes for children affected by substance abuse. The second discretionary opportunity that I want to highlight. Historically, this grant had been primarily focused on addressing the substance abuse needs and challenges of parents, and we try to encourage the focus also equally on promoting well-being in this organized way of screening, assessment, and evidence-based interventions. So this was an existing grant that many communities have had over the past decade or so that now has, in its current incarnation, an equal focus on well-being of the children in families where substance abuse is a concern. And then this is the original discretionary grant that was, I believe, in 2011 that articulated this screening, assessment, and evidence-based intervention approach. The initiative to improve access to needs-driven, evidence-based, and evidence-informed mental health and behavioral health services and child welfare. And you'll see a number of jurisdictions that were awarded this opportunity and are well underway and already creating numerous lessons learned about how to do this work well. And I have the first one last because I want to highlight the District of Columbia as an example of a partnership between child welfare and system of care in the context of these new federal opportunities. So the District of Columbia took this grant opportunity that we just talked about, and it created work here in DC to use comprehensive screening, functional assessment, data-driven case planning, ongoing progress monitoring, and importantly, service array configuration to address the needs of children in the child welfare system. And they did that with a strong partnership with their system of care that is housed in the Department of Behavioral Health Services here in the District of Columbia. So there was already an existing system of care, and as DC began implementing and planning and implementing this work, it went straight to system of care and said, help us to do this. You have the expertise and the knowledge to do this well, and we want to partner. There's a link down at the bottom of the slide that gives you more information about how the Child Welfare Agency, known here as Child and Family Services Agency, and the system of care partner to put this approach together. In addition to examples of discretionary grant funding, I also want to highlight the President's budget proposals of fiscal year 2015 and fiscal year 2016. These proposals, not yet enacted, crafted an opportunity that, again, supported a partnership between child welfare and Medicaid to address the needs of children, particularly those where over-prescription or over-reliance on psychotropic medication is occurring with kids in foster care. And this $750 million opportunity over 5 years was designed to do a few things. I'll talk about that. First is to implement more effective courses of treatment, including evidence-based therapies. The child welfare side, through the Administration for Children and Families, would receive $250 million, and CMS, Medicaid, would receive $500 million to disperse in incentive payments. Let me talk a little bit about how each of those entities would use the money. So to build the child welfare capacity, several things would happen. Enhancing the child welfare workforce to understand the needs of children receiving psychotropic medications, as well as to understand the use of evidence-based interventions and how to deploy them, providing reliable screening and assessment tools, coordination funding, particularly between child welfare and Medicaid, especially in the early and periodic screening, diagnosis, and treatment benefits from Medicaid that requires the amelioration of problems identified in screening and assessment, regardless of whether or not those services are identified in a state plan. And training for foster parents, adoptive parents, guardians, and judges, as well as implementing an evaluation and providing data. On the Medicaid side, for incentives, there would be a performance-based structure put in place where states and jurisdictions would be rewarded for increasing access to evidence-based psychosocial interventions, improving care coordination to improve outcomes and reduce the over-reliance on psychotropic medication. We talked earlier about policy levers to focus on well-being and improving children's chances of being successful in life. And the Child and Family Services Improvement and Innovation Act of 2011 did just that. It was a small but important change requiring Title IV-B agencies to treat and monitor emotional trauma associated with maltreatment and removal from home. And it also required protocols for the appropriate use and monitoring of psychotropic medications. So states now have to, in their plans submitted to the federal government, address how they will do each of these things. This is a new requirement and an important one that provides a hook for communities to articulate how they will address trauma and how they will reduce over-reliance on psychotropic medication, including monitoring of that usage. Flexible funding has also been created through Congress. The Title IV-E funding stream at the federal level has historically been used to provide support for children in foster care. And there has been long-standing recognition that a more flexible approach to that funding stream is necessary, in part to prevent children from coming into foster care or to help them return home more quickly than they might otherwise. That work is known as the child welfare waivers. There are now 27 states, and we'll talk a little bit about that, who have received waivers to use this money more flexibly. The application to the waiver asked and said to states, we'll give priority to applicants who want to test or implement projects that produce positive well-being outcomes with an attention to trauma. So we tried to infuse into the waivers a priority. Certainly states did not have to focus on well-being, but we were delighted that they wanted to. We also encouraged an emphasis on social and emotional well-being for children available for adoption, because we wanted to make sure that all children, not just those who might come into care, but those who've been in care sometimes the longest, that their social and emotional well-being needs were attended to. So the 27 states that were approved between 2012 and 2014 are noted in the 3 columns to the right, and there were also 5 waivers that previously had been provided and are still in use. The point here really is that almost all of these states have embedded the use of screening, functional assessment, and evidence-based interventions alongside progress monitoring to improve social and emotional and sometimes also physical and cognitive well-being for the children in their child welfare systems or at risk of entering their child welfare systems. So as you look at this list and you see your state, understanding the exact approach that's being taken and where and how the waiver is being organized in your state is a tremendous opportunity for understanding how you can contribute to the success of that work and how the resources that you have available to you could be augmented with the waivers in order to leverage additional positive outcomes for children and families. This is a really exciting opportunity, and I hope that you will seek out the work that's happening in your state. This slide really just shows the extensive use of evidence-based interventions in the waivers. So this list provides promising evidence-based interventions, supported evidence-based interventions, and well-supported evidence-based interventions according to the categorization of the California Evidence-Based Clearinghouse for Child Welfare that are being either used or considered in the waivers in the states on the previous slide. What has happened as a result of the waivers and these other levers that we've been talking about thus far is the move away from a relatively generic service delivery, as we talked about at the very beginning of the webinar, and towards a more organized way of doing child welfare work, so that families and children are now far more likely to receive an intervention that has shown some evidence of effectiveness in the literature. They've not all shown effectiveness for families known to child welfare, but many, many of them have shown effectiveness for families who have the similar constellation of experiences and clinical profiles, so that we are testing through the waivers the extent to which evidence-based interventions are likely to improve well-being outcomes and likely to decrease the likelihood of entering foster care and decreasing the amount of time that children and families spend in foster care. So in conclusion, I hope that you'll be able to use the resources and the knowledge that you've gained today to reach out to partners within your community in child welfare, in Medicaid, in mental health, in juvenile justice, in the whole human, in health, in the whole human services continuum in your communities, to focus in on this really vulnerable group of children and families, and crafting a well-being agenda that is likely to result in better outcomes than we might otherwise receive by acting alone, or by not organizing a service array that is going to hopefully yield much better outcomes. Because really, collective action is needed. None of us can do this work alone, and so that means that all of us must contribute to this work. So I'd like to just remind you in closing about the brief that's available online. The link is here, Child Welfare and Systems of Care, Opportunities for Partnership. Please take a look at it. Please print it out and print out a number of the other tools that we talked about today, and make an appointment with your legislator, your child welfare director, your behavioral health coordinator, those people in your community who are doing this work. We look very much forward to seeing how systems of care and child welfare can take this new time, this new day, and change outcomes for children and families. So I'd like to thank you for your time today, and I'm looking forward to seeing the outgrowth of this work in your community. Thank you very much.